So, um, so we have seen different methods of airway management in our session. We have seen that we must differentiate between needs for providing only lung collapse, which is usually the case, and then sometimes we have to have lung isolation to isolate the ventilated lung from soilage and pus, or provide ventilation as such. And for lung collapse, you both DLT with or without incorporated video cameras and bronchial blockers are equally good. Good choices. Local expertise and price might be guides to use one of the two methods. For lung isolation, a DLT is usually the best method, as it provides easy access for suction and CPAP to a non-ventilated lung. Newer DLTs or single lumen tubes with video incorporated embedded cameras allow surveillance of the carina and early detection of tube displacement, especially in scenarios where access to the patient is difficult, but however it does not preclude the need for fiber optic bronchoscopes. That must be said, because sometimes people say that then you don't need a bronchoscope. Of course you need a bronchoscope in these cases, and it might be seldom that you don't need a bronchoscope in this setting. In the scenario of anticipated or unanticipated difficulty, airway DLT is usually difficult, even and sometimes impossible. Therefore, single lumen tube and user bronchial blocker is the method of choice, and enforcing DLT intubation only if unavoidable. And a difficult airway always needs teamwork, and that should be stressed. Lung transplantation is a special case of difficult airway management. A left side DLT seems to be the best choice in most cases. And I'd like to thank everyone who has attended the webinar. We hope you enjoyed it, and I ask you to give us feedback.
I think we are good for now. Thanks everyone. It was a real pleasure to chat with you this afternoon. Just before I close really this session, I would like to introduce for a few words Fabio Garacino, Professor Garacino from Italy, who is the president of the EACTA, who would like to say maybe one word, maybe some words. Please, Fabio.
I think that this afternoon we really had a very, very excellent webinar. As you all know, this is the second webinar EACTA has organized. I think that the today webinar was really very good. The topic was very interesting, and all the lectures were very clear and I would say exhaustive. Everything was explained in details. The pictures were fantastic. The videos were very good in quality. So I really would like to thank the chair, the moderators, the speakers, so all the faculty, and also the organizers. May I send a special thank to Mohamed El Taan, who is the chair of the educational committee, who did really a great job in arranging all this and trying to keep everything in line. And a special thank to the social media task force and the entire educational committee for their job. I would like to remind all the attending colleagues that the webinar is accredited for the UEMS, and so they will receive CME credits. And a special thank from me personally and from the entire board of directors goes to Ambu, who provided the EACTA with an unrestricted educational grant, and we are really very grateful to Ambu for this. So again, I think we had a very, very nice educational activity this afternoon. I thank all the faculty and all the people who were involved. A special thank goes to the Thoracic Subcommittee for their support. And please keep in mind that we are going to have an EACTA webinar in October, November. This will be from the Intensive Care Subcommittee, and I'm sure this will be another excellent educational event EACTA is going to run very soon. So thanks everybody for joining and for staying connected till now. Thank you and bye-bye.